This is part C in our module, Understanding the Allied Health Assistant Workforce and Understanding the Principles for Successful Redesign of Your Workforce when you introduce assistants. In this session, we're going to be talking specifically about the principles behind successful AHA implementation. The reason why this is important is because introducing allied health assistant models of care is a complex process. We know that the process itself of introducing the model of care can influence the success and effectiveness of the allied health assistant role at the end of implementation. So it's important that everybody considers the complex nature of the change process required to implement these roles. And in saying that, we need to acknowledge that there is significant interplay between different professions, disciplines, staff members, regulatory training and organisation structures that allows for these roles to be effective. So it's not just what the AHAs do, it's actually the process of how you implement these roles that enables them to be successful. We're going to go through the core principles now associated with successful and effective implementation of AHA roles. These are important for you to consider in the next and coming modules. Number 1, more efficient use of allied health assistants is associated with clearly defined roles. Number 2, more efficient use of allied health assistants is associated with clearly defined, unambiguous and understood delegation practice. Number 3, more efficient use of allied health assistants is associated with the delegating practitioners having confidence in and trust in the allied health assistants. Number 4, more efficient use of allied health assistant roles is associated with delegating practitioners understanding the role, training and competencies of the allied health assistants. Number 5, more efficient use of AHAs is associated with allowing practitioners to work to their full scope of practice consistently and having structures to reinforce this. Number 6, less efficient use of allied health assistants is associated with protective or restrictive delegatory frameworks, where the allied health professional restricts the allied health scope of practice. We will cover this in great depth. Principle number 7, we understand that greater staff satisfaction is associated with allied health assistant models of care that provide for greater career development opportunities for all staff involved. Greater staff satisfaction is also associated with role clarity. So not only are patient outcomes enhanced, so are staff outcomes when there is role clarity. We know that greater staff satisfaction is associated with allied health professionals seeing value in the allied health assistant role. We also know that greater staff satisfaction is associated with appropriate support and resourcing for implementing and then ongoing management of the AHA role itself. The sustainability of an AHA role is associated with codification of processes, practices and training used to implement and manage the AHA role on an ongoing basis. We also know that greater levels of success is associated with the legislative scaffolding to reinforce the role, such as award and pay structures and industrial agreements. And finally, we know that greater levels of success is associated with AHA roles that are appropriate to the context. In the following few modules, we're going to go specifically through the contexts and mechanisms required in order to enable those core principles to come into place. We're going to follow a case study of a for-profit disability and aged care organisation in a regional rural area in New South Wales. Here is some information about the case study that we'll be following. We're going to use this information interspersed through the following modules to help understand how this for-profit organisation has used some of the principles that we've just gone through.